Well, in this video, I want to go ahead and take a look at the malaria situation in Venezuela and compare some of the official numbers from the Pan American Health Organization, which I'm sure is closely tied to the Venezuelan Ministry of Health concerning these numbers. And what triggered this idea was the recent epidemiological update of malaria in the Americas that came out earlier this week. So let's take a look at what it has to say. It says between 2005 and 2014, there was an overall decreasing trend in the number of cases of malaria in the region of the Americas. However, since 2015, there has been an increase in the number of malaria cases reported in the region. This overall increase is due to the increase in the cases over the last 3 years in Venezuela, along with increased transmission in endemic areas of other countries like Brazil, Colombia, etc., etc. So let's go ahead and take a look at what they say about Venezuela down here at the bottom. There it is. Okay, in Venezuela, between epidemiological week 1 and 41, which is the week ending October 11th of 2019, a total of 323,392 malaria cases were reported, and representing a slight decrease compared to the same period last year in 2018 of 328,373 cases. And they talk about the different states that have been hardest hit by malaria and some other information. But what I'm really concerned about is the overall numbers. So for the first 9.5 months, essentially, they're saying 323,000 cases. And those are the official numbers. So what do other people say? This is something I've been covering on the website, outbreaknewstoday.com. And just to compare, this was something I did early this year concerning the 2018 numbers. And according to my reporting here, numbers that were thrown out there unofficially by the Venezuelan Ministry of Health and the Pan American Health Organization was that there was about 430,000 cases for 2018. But, talking to an expert on malaria and other infectious diseases in Venezuela, Dr. Leopoldo Villegas, had a chance to talk to him, and he says nobody working in health in the country believes this data. He notes that the numbers are much higher. And just in this little chart here, I can show you real quick, they compare the cases from 2010 to 2018 to be, concerning malaria, 45,000 up to over 1 million by 2018. So things are much different concerning what Dr. Villegas is saying. And Dr. Villegas is with a number of different, I believe they're NGOs, and Global Development One was one of them. And they kind of got together and they call themselves civil society. And a consortium of 5 global health organizations that include Global Development One and others are doing forensic epidemiology and rebuilding the National Malaria Database 2018 and the whole history from 2000 to 2018. According to Dr. Villegas, they have data from several sources, the Ministry of Health, several Sentinel sites in different states, and the numbers are just unbelievable, he says. He told me in an email, our latest numbers are 1,302,670 malaria cases in 2018. And this was as of February 14th of this year. This includes new cases, relapses, self-medication, and underreporting during 2018. To make things more astounding is the number may even get larger. Villegas said they received more confirmation from the ground and identified another big gap in reporting cases in hotspots of malaria in Sucre state. In addition to Venezuela, of course, and the Pan American Health Organization do point this out, that Venezuela has really been the epicenter of malaria in South America, and it's spread in pretty large numbers to several of its surrounding neighbors, including Brazil, including Colombia, which have been hit the hardest from imported cases from Venezuela. The number of reported cases of malaria grew from 136,000 in 2015 up to over 400,000 in 2017. In fact, in 2015, Venezuela saw a record number of malaria cases with 136,402, the most reported in 75 years since reliable records have been kept in the country. So, but it only gets worse too. So let's take a look at the next piece of information that I have. And this past summer, I did a radio interview with Dr. Villegas concerning more updated numbers and estimates for malaria in Venezuela. Let's take a look at this. So this consortium of organizations, I believe they're NGOs, are predicting the malaria situation is only going to get worse, forecasting 2.5 million malaria cases in Venezuela by 2020. And I can link to the discussion with Dr. Villegas down below, so check that out. But here's some of the charts that he gave me. From the Ministry of Health data, from 2000 to 2018, they're saying malaria cases increased by 1,262%. However, according to civil society, this consortium of NGOs, they're saying it's increased by 2,373%. And this last fascinating chart actually compares the World Health Organization estimates, the Venezuelan Ministry of Health estimates, and the civil society estimates. So here they are. So in 2019, the WHO estimate was supposed to be somewhere in the ballpark of over 500,000. Venezuelan Ministry of Health was supposed to be slightly less than that. And civil society was looking at somewhere in the ballpark between 1.5 million and 2 million cases. So something's not jibing there. And these people around the civil society, these people are on the ground doing this forensic epidemiology, all this legwork, discovering cases that aren't being reported by official sources. And here's the forecast that I talked about momentarily, a few moments ago, that in 2020, you can see right here that the WHO estimate and the Venezuelan Ministry of Health estimate is not much higher than this year. But civil society is saying by 2020, they should be seeing 2.5 million malaria cases that year. So something isn't jiving. And I definitely encourage you to check out the podcast, listen to Dr. Villegas, and we would love to see better numbers from official sources. And we appreciate the work that civil society is doing down there in Venezuela, not only with malaria, but all the other infectious diseases that are running rampant, measles and diphtheria and others. So, okay, well, I hope you enjoyed that. If you want more information on it, I'll put it down below, and I encourage you to check those out. If you like the video, please like it, comment below, share it with your friends, subscribe to the channel, and I'll see you next time.